Dr Omar Abdel-Mannan is a paediatric neurologist who has spent a decade in Gaza. He is the founder of Gaza Medic Voices and joins me now from London. A warm welcome and thank you for taking the time. I appreciate you must be very busy. Now, you've spent
Thank you so much.
10 years in Gaza, I understand it, and you're fully aware of the medical infrastructure there, no doubt. How would you compare the situation now to what it was like when you were there?
Sure. So thank you so much for having me on the program. Just to be clear, I've been going in and out of Gaza annually with a delegation of medics and surgeons that go and teach, and some of them operate. I'm a physician by training. So we normally go and spend around a week to 2 weeks in the region, and then we leave. So unfortunately, we're not living with the people there, but we are extremely close to them. We have many friends and colleagues who we are in close contact with. And through our platform, Gaza Medic Voices, we have been, since day one of this war and siege, been following the doctors and speaking to them through voice notes, through messages. What I can say is, and this is directly from the doctors there, the situation currently is unprecedented. The catastrophe and humanitarian catastrophe that is unfolding before our very eyes is on a scale that has never been seen before in Gaza or frankly anywhere in the world over the last half a century. This is unprecedented in apocalyptic terms. The doctors there who we speak to mention hospitals that have collapsed, healthcare facilities that have been bombed, ambulances that are being bombed, civilians that are coming in their droves with humongous volume of injuries, and the infrastructure has just collapsed. I had the opportunity yesterday to share a Twitter space audio call with some colleagues who are from Gaza but have traveled abroad and are working and studying in the US and in the UK. And we had a doctor join us, Dr. Ibrahim Mattar, who is a internal medical doctor in Gaza. And he told us about the horrific situation there. He described to me that on his last shift, he had 3 of his colleagues come in dead. One of them was a woman female doctor who came in and actually was pregnant, had a fetus inside her and was dead. The other was a close friend of his who, unfortunately, and sorry to be graphic, but when he came in, the head was separated from the body. So he was essentially beheaded from an Israeli shell. And these are the scenes that these doctors and healthcare professionals are working with. And unfortunately here in London, in the UK, in the Western world, in America, our politicians are just letting Israel continue to bombard and bomb these civilians to an extent where there is mass death, mass destruction happening. And in the words of the UN, Gaza is headed towards genocide if it has not already headed towards that. So this is untenable. This situation needs to change. And as healthcare professionals, as in people who care about human life, who look after sick children, I'm horrified and we're horrified to see the targeting of healthcare professionals, the targeting of doctors, the targeting of civilians, and this mass killing. And as a result of that, we are holding a vigil on Friday at Downing Street at 6 o'clock, and we will be there in our hundreds and hopefully thousands calling for an immediate ceasefire. When I spoke to Dr. Mattar yesterday, I asked him in this 2-hour conversation, what is the one message you have to the Western world? And he said, I don't want your prayers, I don't want your feelings, I don't want your thoughts, I don't care about any of that. God is with us. What we want is an immediate ceasefire. This is what needs to happen now. They don't want money. They don't want fuel. Well, they need fuel, but they don't want money. They don't want that sort of help. They actually want the West to stop Israel from continuously bombing this residential area of 2 million people, of which over a half have been internally displaced. Over 10,000 people have died. Thousands are under the rubble, and these are children. And Save the Children quoted that every 15 minutes, 1 child is dying in Gaza. Every 15 minutes, 1 child is dying, and 2 children are being injured. That is not acceptable. In 2023, in a postmodern world where we value our ethics and our moral codes in the West, the hypocrisy and the level of vitriol that is happening for people who stand up for peace, who stand up for humanitarian aid, this is disgusting, frankly.
And Omar, I mean, it's horrifying what you've just described there, it really is. What does this Israeli bombardment mean, though, for the near future of the medical facilities in Gaza?
What it means is, and this is coming back to your question, this healthcare system has been under siege for 17 years. This did not start on the 7th October. This country, this area, this region was under blockade by land, sea and air. People could not move. They had to walk across a 1 kilometer cattle gate tunnel, essentially, to get in and out if they were lucky enough to have the permit. So the healthcare system was on its knees and it has now collapsed. Half of the hospitals are completely unusable. They are destroyed. Many of the hospitals have been bombed. A children's hospital was bombed. A children's cancer hospital was bombed, where children were having chemotherapy. So this tells you about the nature of the beast that we are dealing with and the lack of humanity from the IDF and the Israeli government. And frankly, if this continues, there will be no more Gaza for anyone to go to and anyone to help. And what we have to remember is there is direct death and direct effects of residential area bombings, but there are indirect effects of war, of the collapse of infrastructure. When you bomb bakeries, when you bomb water sanitation plants, that means you starve a population of food and water. That means you increase the risk of infectious diseases spreading. Dr. Matar told me he was seeing patients with infections and wounds where worms were coming out of their wounds. These are deep wounds down to the bone, and they had worms because they could not be treated with antibiotics. And these are children. These are children, women, and men. And this has to stop. Our leaders have to call for a ceasefire instead of warmongering and continuing to push for a complete annihilation of a whole society.
Omar, if that ceasefire does indeed happen, how long would it take to stabilise the situation in Gaza's already strained medical infrastructure?
What the doctors are telling me is they have described this as their second Nakba. They call this Nakba 2023. The Nakba, for your listeners, happened in 1948 when the Palestinians were displaced from their land and it became the occupied Palestinian territories, which it currently is, occupied by Israeli forces. And what they are saying is the amount of damage that has happened, the infrastructure that it has destroyed will take decades to rebuild. No amount of money, no amount of help will get them up on their feet within weeks or months. This will take decades. And many of the units, many of the hospitals that we have seen, ones that I've worked in, hospitals, healthcare facilities, are literally just flattened. There is nothing left there. And this is a population of 2 million people. Life goes on. People have heart attacks, people have strokes, people have common chronic conditions. In the current situation, people can't get into an ambulance and people are dying from excess mortality, which is as a result of cutting off these supply routes. And what does the West offer them? What does Israel offer them? 40 to 50 trucks a day? I mean, that is a complete joke. We had 500 trucks of aid going in every day to this region, and they've been offered a morsel, almost tempted, almost like holding it at arm's length and parading it in front of them. This is, again, a disgusting situation, which, as a humanitarian doctor, as a person who cares about our morals and our ethics in this world and in this current climate, we should be standing up against this and saying enough is enough.
Dr. Omar Abdel-Mannan, thank you so much for speaking with such detail and passion with us here today. We appreciate it. A paediatric neurologist who's worked in Gaza for over 10 years, and you still go there. Thank you so very much.